Okay, thank you. People from the board of directors, the dean of the School of Economics, the director of the Department of Psychiatry. It is great to be here, Dr. Santamaria, who was the person in charge, with help of other colleagues, of this doctorate program to
I have a brief presentation that I would like to take a look at the journey of what the PhD in neuroscience was. This started since 2012. We came up with the idea in 2012. We had a large project, an important project. That is the one here that was prepared with psychology that was called Primary Care in Mental Health. This project went from 2012 to 2019, and in that, by error or intentionally, we wrote that we were going to design a neuroscience PhD, and that was a problem because in Colombia PhDs has a severe inconvenience in terms of having enough or available professors, but especially because the process does not depend on the university itself, but it's a process that has to go through the Ministry of Education and the Ministry of Education. There are peer reviewers, and some peer think that it might be suitable, others not. But the commitment with the Ministry of Science was uh, to open a PhD programs. So Doctors Matallana, Dr. Miguel Uribe, and Dr. Santa Maria, and everybody who were cooperating in this had to do a lot of work. But strategically, we joined with the economics department, and we were able to have the minimum requirements for a good PhD, an excellent PhD. That was the idea in the Javeriana, and in 2020, uh, it started to move. But there was something important here. That is, here we started to work a lot in neuroscience, in mental health, and we started to work on that since 2012 with all the professors, both in psychiatry and in the Aging Institute, the Javeriana. That has a large project called Intellectus, where we based all of this. Here we have Dr. Diana Matallana, who had to suffer with this process. But luckily, it went well. After this, we started to work in peace in the school medicine. And there is a project that came up like in 2017 that has two books that we started to work. One is this, the Phases of Reconciliation, where we think that in the occasion of the signing the peace agreement, we needed to understand what people understood by reconciliation, because the definition is quite diffuse or quite different. And so, with a participatory photography project, we decided to see how people would take a snapshot of what it meant to them, reconciliation, and they would tell us what this is. And from there, we extracted some Colombian dimensions of what the people think that should be included in the definition of reconciliation. This book is on the web. It's actually has been translated into English and is available. It's free. It's free. Okay. So if you could also help disseminate this book, I think it's really important. It has wonderful pictures. There is also an exhibit with the pictures that were taken by the people participating in the project. After this, we thought, and we had the wonderful participation of Dr. Matallana, Cecilia Santa Cruz in the group. We were working on this around seeing the people who were in the conflict, who suffered the conflict, but that became heroes of a peace. They became peace leaders in their regions. And there we went to do some in-depth interviews in Colombia, selecting people who had suffered a lot, and for A or X or Y reason, they became leaders of peace, in spite of having his wife being raped or children who had been murdered, etc., from all the sides, not only citizens but also military, paramilitary people who had been in the conflict and now were in peace, to understand their thought. Because from there comes a lot what you study in neurosciences and mental health. This book is also available on the web. Unfortunately, this one is not in English, only in Spanish, but it's open to all the public. After that, we started thinking that the area of communication was important and how we would communicate and how we could harm each other by communicating. We have seen in the country some harsh clashes in like different names that are used in the stigmas, and so this is the second edition that is also available on the web. This book that is called Communicating Without Harm, and we in the first volume worked with 70 experts in communication and mental health to write about a topic where there isn't a lot of literature. There hasn't been a lot written. Some things about the Werther effect, some small things, but the large majority we didn't have available. So there was this book that then resulted into a second edition that we have been improving to know how we should communicate without harm. Targeting, of course, journalists, but communicators, because journalism, unfortunately, I don't know, also expanded. Like now, everybody's a journalist or communicator with the media, social media, etc. So this book is the basis of what we have been working on, say, in the medicine school. After this, we got the qualified registration and qualified entry. And Dr. Isabel, she worked with the last graduate school director to implement all of this. Dr. Santa Maria was the chief, Diana Matallana, and was the great assistant and helper in the entire PhD. And we started with the PhD program. Today we have 7 students in the PhD program working from a perspective of mental health. In 2015, one of the very first times in the world that we measured the social cognition in the population. And we have data in this mental health study with uh, actually where many of us participated, and Diana Matallana was the coordinator. In the aspects of social cognition, we measure this term empathy. Because up to 2015 we didn't talk much about empathy, and I think that based on this study, everybody started to talk about how apathetic we are and how important empathy is in Colombia. I think that influenced a lot. Probably the data can be attractive to analyze. There have been several studies of recognition of emotions. There we saw that Colombians recognize more joy. Supposedly, we are the happiest country in the world, but it's apparently that we do not recognize very well sadness, anger that easily in faces. And there were some country differences. In some regions in the coast, they had some predominant ideas, and in others. So it gave us a very interesting idea to start with all of these of social cognition. That it was something that we didn't talk a lot in Colombia. So this germ from the clinic we imposed in the collective. I said that this book is quite interesting. This is also in the web of the results, and there are several articles that have been led by the group around this issue. So the idea is that the school as such has been very involved in everything that has to do with peace. with cognition, neuroscience, and for me it's a pleasure to be here joining this opening of the event. Thank you very much to the group for everything they did because it's a wonderful program, wonderful guests. We expect to learn a lot from them, and I think that it shows something of what we have been doing in Colombia and in the world. Thank you very much for being here.